Hello everyone, I wanted to give a short screencast, I'm hoping 8 minutes or less, on this assignment. The goal of this assignment is to give you the opportunity to practice writing questions based on content you're not strong in. This has proved to be an effective method in learning material that a student or candidate for the national exam is struggling with. The evidence I have to prove that's effective is different research articles that I've uncovered, but in particular my own practice working in pilot projects with candidates who have not passed the licensure exam after their first, second, or third attempt. And practice has resulted in a big uptick in scores when candidates embrace this assignment and work on writing good content questions based on content they're not strong in. So what the expectation is by Thursday, the 23rd of May, by just before midnight, for you to write 5 questions. Now you've already had the practice of writing 1 question during week 3 optional lecture in Eugene in room 114, and you are certainly welcome to use that question. Here's 4 possible answers to your multiple choice question, and those answers need to follow the criteria that's right in here, and you do not provide the correct answer. So in GILES you have the blueprint on page 1622, which really covers those categories related to content area on the exam. So certainly there's a blueprint that talks about how many questions will come from different sections, such as musculoskeletal, cardiovascular, neuromuscular, other systems. But they also come from categories within those systems related to data collection of related to neuromuscular health conditions, or working with someone with a neuromuscular impairment, as well as specifically conditions that impact effective treatment that could come from the cardiovascular disease category, such as congestive heart failure or COPD. And interventions can come from certainly any of those categories. The most rich categories is musculoskeletal. Interventions would be, for example, stretching or strengthening exercise. The non-systems modalities are a big category within that, and I included in the parentheses some of the other content included in non-systems, such as what we talked about during our lectures in PowerPoint, and covered again in GILES 16 to 22 on evidence-based practice, professionalism, safety and protection, and equipment. I do not want you to lifting material from GILES. Actually, I want to challenge you to go outside of GILES. That has been my mantra since we started talking about a licensure exam, is to use GILES for certainly a reference to help you in terms of getting a brief snapshot of information, but most of your information content to review and prepare for the exam needs to come from course-related materials. So, for example, it could come from Cameron, Dutton, Lippert, Umfred, for example, or from specific lectures from instructors you've had throughout the curriculum, lab or lecture. So here is a really good little, so kind of get into a nutshell again of the expectations. You're to write 5 exam questions posted in the forum for the week. So if you go back to the course and go into the week, and this is something you'll do right before you come back to clinic, and I know I'll probably get some a little bit of pushback from that, especially in course evals, that I've had you do this during clinic. But the goal here is that I really want you to be practicing and preparing for the exam while you're in clinic, and this is a way to have evidence that you've done so. Evidence that certain CAPTE wants to see in terms of program accreditation but also evidence that is going to help support you as you prepare for this licensure exam. So it's a forum, and you're not going to be in groups. You just add your discussion topic. It is worth 10 points for writing those 5 questions, 2 points each. Okay, and then what you're going to do after you post those, you have an additional 3 days to reply to one or more of your classmates. So each one of your replies is going to be to their questions. For example, if Gina writes a question on musculoskeletal interventions, and she writes a question on cardiovascular disease, and then maybe 2 or 3 from neuromuscular physical therapy data collection or neuromuscular interventions, right? Because these are just examples. These can all be interchangeable, right? So you can jump in and answer 4 of the questions that Gina posed, and you would have completed this part of your reply. I think it's always good to try to reply to a couple of classmates, certainly get a flavor for different types of TEPS questions. It doesn't have to be, you don't have to answer questions that you don't know. You can answer questions that you know. So, and then when you are answering your question, provide a reference from a course related material that you use. If you didn't need a course material, you just knew it automatically, I'm okay with that. You don't have to reference, but if you did some research, yeah, I'm taking that back, sorry. For your questions, I said don't take it from Giles as earlier, definitely provide a reference for where you got the information, but when you answer the questions, you don't need to provide any references as to information. Just answer the question. If you had to do a lot of research, I think it's good for your classmates to post where you found the answer. Like doing a little scavenger hunt. I used UMFRG, for example, on the section on MS to answer the question related to MS and just cite, what page or just say UMFRG chapter, whatever, just like use an APA format. It doesn't have to be follow a specific structure except APA, okay? And if you're going to, cite a reference that you use to look something up. So I hope that makes sense. I will just reiterate one more time that you answer 4 questions that are put in the forum. I don't want you answering what someone else has already answered. I want to keep it fresh. So, for example, if somebody's already answered all 5 of Gina's questions, don't jump in there and answer them again. That makes no sense. I'm having you answer 4 questions, so that certainly there'll be an opportunity to answer, 4/5 of all the questions that are posed. If they're all posted in a timely manner, which they will be. Yeah, for example, if 4 of Gina's questions are answered, there's 1 left, go ahead and answer 1 of hers. And if Hannah posts 5 questions, 3 of hers are answered, you can answer 2 of hers. And then if Jolene has 5 questions posted and 4 of them are answered, answer 1 of hers, and then you got your 4 answers, right? You answered a couple from Gina, from Hannah, and Jolene. It needs to be 4, okay? So that should cover that really well. I'm getting over my 5 minutes or 8 minutes, so I'm being a little bit bad here. But here it's just, I thought, a really excellent, and I want you to follow this, and we talked about this in week 2 lecture, of just some principles in effective item writing for the exam. And I got this from the workshop, and I've abridged it a bit, or have modified the language a bit from the workshop to make it more centered toward language that students should be familiar with versus academic instructor language. So it needs to be scenario-based, should be based on important elements of MBTA content outline as discussed in the blueprint, and those pages are referenced going back here, right? 16 through 22. They need to be, why am I asking this question? Is this an important concept? And the other question I think is important to ask, could a patient be harmed if the licensed PTA did not know this information? And I think that's highly relevant when you're talking about pharmacology and modalities, and certainly appropriate exercises in appropriate stages of rehab, at the appropriate stage in rehab. Make sure that it involves some clinical reasoning or some higher level thinking, not making them ridiculously hard, but make it practical. And just keep that in mind of not going beyond 30 words and keeping, within 3 sentences max, and avoiding ambiguous words that don't have relevancy. And but use certainly characteristics that are relevant, like I used in the example. Okay, so that should be enough for now. I look forward to seeing your questions, and then hopefully taking several of those questions and putting them into the final exam for the course. All right, have fun with this. I think it'll be a good learning experience. There's no question about it.